In this unit, we consider how we can make our design more intuitive and easy to use by considering how the end user will interact with the design solution. The first reason that we care about human factors and user-centered design is because a well-designed device can significantly reduce the risk of errors in its clinical use, and it is a requirement of medical device regulations. The second reason is that a well-designed device will be more likely to be appreciated and purchased by customers. A third reason is that well-designed devices make training and education a far easier task. This, again, is a requirement of device regulations. The goal of this unit is to provide the tools to create a user-centered medical design. It is critical to understand that user-centered design needs to be embedded at every stage of the design and development process. It is not just an afterthought. It begins and ends with the end user, and the final technology solution needs to respond to the initial clinical need of that user. In designing user-centered medical devices, we will seek to embed 5 principles of good design. These are simplicity, consistency, standardization, safety and user satisfaction. Simplicity. Simple product design means eliminating all unnecessary complexity or required learning from the end user. Simplicity also means limiting user inputs to the system and keeping control levers, buttons and interfaces as easy to use as possible. A simple design should eliminate all unnecessary user interaction with your technology. Where you do need several layers of user interaction, simplify your user interaction by keeping less important functionality further from the user's immediate reach. Consistency. Consistent design means that your design appears familiar to the user, even if it performs a function which is new. For mechanical designs which require user actuation, try to look to familiar household tools and utensils for guidance in creating a consistent user experience. Interacting with electronic devices should try to be consistent with the user experience on the smartphone or tablet. Visual clues and colours for moving parts can help create a more consistent design experience for the user. Consistent design is intended to make your product easier to use, not more difficult. Standardization. Standards exist for many connectors, control and interaction mechanisms. Integrate these into your design wherever possible. Safety. An intelligent design is a safe design. In order to mitigate risk and reduce misuse of your product, you should consider what could go wrong in the use of your product and then adjust your design in response to these risks. Document these changes and again look for feedback from your clinical champion and end user. User satisfaction. User satisfaction is the most difficult design aspect to implement and measure because it is often the emotional response of the user to your product. An aesthetically pleasing and visually attractive design is important, although soft curves and interesting colours will not hide deficiencies in the product's function. However, a functioning product which also looks great is the key to a successful design. Once you have refined your design to embed these 5 principles, it is critical to test your design with end users. Your end user may not be the person who pays for the device, but he or she is the person who will use the device on a regular basis. Identify potential end users and try to present a prototype or demonstration of your design solution to them for feedback. Your clinical champion is often critical in this process. You might use questionnaires or focus groups to generate feedback on your preliminary design. This feedback should then inform future design modifications to your device. These techniques are very useful at an early stage to identify explicit needs of the end user. Future research may be required to identify the latent or non-obvious needs which are often not easy to articulate or quantify. The key outcome from end-user feedback should be to identify and eliminate risks of using your design. These risks will be classified in future regulatory submissions. At this stage, we simply wish to identify these risks and develop strategies and design solutions which eliminate or alleviate these risks. Finally, we need to test the new design to validate our improvements. You can make use of the many excellent online resources available from regulatory bodies such as the FDA when you look to create a user-centered design. At the end of this unit, you should have clearly identified the main risks of using your proposed product design. You should also be able to address these risks through the 5 principles of simplicity, consistency, standardization, safety, and user satisfaction. Finally, you should be able to test your design with real-life end users and document your findings and results. In the next unit, we will examine what materials we can use to implement our final design.